Hello, I'm Dr. James, and today we're going to talk about something incredibly important yet often overlooked. Have you noticed the subtle ways a woman's body changes after 60? These are changes almost no one discusses, but they can profoundly impact your health, well-being, and even your self-esteem. We talk about skin thinning, hair changing, or sleep patterns shifting. But there's one part of the body that suffers in silence, an area many women avoid looking at, touching, or even mentioning: the intimate zone. After 60, the vagina and entire pelvic area undergo deep transformations. Natural lubrication diminishes, protection against infections lessens, and the pH balance shifts. The vaginal walls become thinner, more sensitive, and vulnerable, significantly increasing the risk of infection, burning, pain, and even urinary incontinence. What's truly alarming is that almost no one discusses this seriously. Most women simply suffer in silence, often unaware that these symptoms have a name, a cause, and, most importantly, a solution. A study published in the Journal of the American Geriatrics Society observed over 2,000 women over 60. It revealed that over 70% reported uncomfortable intimate symptoms, yet only 15% sought help or received appropriate guidance. The problem is widespread, but the silence surrounding it is even greater. This silence gradually, often unconsciously, erodes the health of millions of women due to a lack of information, fear, shame, or the misconception that this is just how it's supposed to be. But no, it doesn't have to be this way. And that is precisely why this video exists. Today, in 4 crucial parts, I will show you essential care measures that every woman over 60 should know for her intimate zone. We'll explore natural, respectful, and clear approaches, free from taboos and shame, because your health can no longer wait. Please share your age and where you're watching from in the comments below. It helps me understand how far this message is reaching and who is joining me in this mission to restore dignity, pleasure, and health to mature women in our country. Let's begin. Part 1. The truth about the vaginal lining after 60. As a woman ages, her body undergoes many changes, but few are as ignored as those affecting the vaginal lining. After menopause, estrogen levels, the primary hormone protecting this area, drop sharply. What does this cause? The vaginal walls become thinner and more sensitive. Natural lubrication diminishes or disappears almost entirely. The pH balance changes, disrupting the delicate balance of protective bacteria. Blood circulation in this area decreases, making tissues more fragile. Consequently, the risk of pain, infections, bleeding, and burning significantly increases. This condition is medically known as postmenopausal vaginal atrophy. Unfortunately, many women only realize something is wrong after years of silent suffering. Few realize that natural methods exist to strengthen this lining. With consistent care, it's possible to restore the vitality of the intimate area without the need for synthetic hormones or expensive procedures. Here are 3 simple actions that can help protect the vaginal lining after 60. 1. Natural oils. The use of pure botanical oils, such as unrefined cold-pressed coconut oil, can help restore local lubrication and provide a protective barrier against microorganisms. 2. Circulation activation. Gentle walks, pelvic floor exercises, and even light self-touch to the area can promote blood flow. This nourishes the tissues and accelerates their restoration. 3. Phytoestrogen-rich diet. Foods like flax seeds, fermented soy products, yams, and chickpeas contain natural compounds that can help balance the effects of declining hormone levels. One study, published in the Brazilian Journal of Gynecology and Obstetrics, showed that women who regularly use coconut oil in their intimate area reported a significant improvement in lubrication and reduced discomfort in less than 30 days, all without any side effects. In other words, nature provides us with resources, but it's up to you to allow yourself to take care of yourself. Part 2. What happens to vaginal pH after 60, and how to restore balance before infections, discharge, and burning appear. Did you know that your intimate area has a natural pH, a specific level of acidity that protects against fungi, bacteria, and inflammation? When you were younger, this pH was slightly acidic, and the flora was rich in beneficial bacteria, specifically lactobacilli, which created a robust protective barrier against any foreign organisms. However, with the onset of menopause and declining estrogen levels, everything changes. The pH balance is disrupted, lactobacilli disappear, the mucous membrane becomes more vulnerable, and this natural protection breaks down. The result: unusual discharge, constant itching, a burning sensation, and infections that appear, disappear, and reappear. The worst part is, these symptoms are often confused with poor hygiene, leading to even more shame and silence. But now you know the truth. It's not a lack of care, it's a lack of information. Fortunately, there are natural ways to help restore pH and rebuild this protective barrier. For instance, fermented foods like kefir, unsweetened natural yogurt, and sauerkraut help restore vaginal microflora from within, balancing pH and strengthening immunity in this area. Avoid regular soaps. Most have a neutral or alkaline pH, which further irritates the mucous membrane. Instead, opt for a mild, intimate wash with an acidic pH. Sitz baths with apple cider vinegar can also be beneficial. Add 1 tablespoon of organic apple cider vinegar to 1 liter of warm water for 10 minutes, twice a week. This helps restore pH and soothe mild irritations. One study, published in the journal Menopause, showed that women over 60 who began applying measures to restore vaginal pH experienced a 63% reduction in the frequency of urinary tract infections and recurrent candidiasis. This means that when you take care of the foundation, everything starts to improve. Part 3. The connection between vaginal dryness, insomnia, and decreased libido, and what you can do to bring back pleasure and well-being. Have you ever felt irritable, had disturbed sleep, and a complete lack of desire to do anything without understanding exactly why? You might not have noticed, but it could all be starting in your intimate area. Vaginal dryness is not just physical discomfort. It's a signal that something inside you is beginning to switch off. A lack of lubrication is directly linked to declining estrogen levels, the very hormone that regulates sleep, desire, mood, and even the production of serotonin, known as the happiness hormone. This means that when this part of your feminine essence goes dormant, everything else starts to dim along with it. You sleep poorly, wake up tired, feel disconnected from your own body, and over time, even pleasure becomes distant or painful. But this is not the end of the journey. Science has already shown that natural methods exist to reactivate these functions without synthetic hormones or pills with side effects. Here's what can help. Omega-3s and vitamin E, found in seeds like flaxseed, sunflower, and sesame oil, naturally help to moisturize internal tissues and balance hormone levels. Adaptogenic plants such as maca root and ashwagandha strengthen the female hormonal system, boost energy levels, enhance desire, and improve sleep quality. Intimate care with natural oils, such as almond or rosehip oil, can be gently applied to the mucous membrane for hydration and comfort. One study, published in the journal Complementary Therapies in Medicine, showed that women who used maca root extract for 6 weeks reported improved lubrication, increased sexual desire, and deeper sleep. And most importantly, all this comes without side effects, without dependency, and cultivates a renewed sense of connection with your own body, because pleasure truly has no expiration date. Intimate health is an integral part of your overall vitality, and prioritizing its care is a profound act of self-respect. Part 4. Common hygiene and showering mistakes that harm intimate health in older women, and how to easily avoid them. It might seem counterintuitive, but many women unintentionally harm their intimate area precisely during daily hygiene routines. Yes, this is a common reality. Often, due to a lack of accurate information, intimate hygiene is performed too aggressively, which gradually erodes the vagina's natural defenses. Let's look at the most common mistakes. First, using regular soap or harsh antibacterial products is detrimental. These can strip away beneficial bacteria and disrupt the delicate pH balance, making the mucous membrane far more vulnerable. Antibacterial soap, in particular, overdries and irritates the sensitive skin of the intimate area, a concern that becomes even more pronounced after the age of 60. Another mistake is vigorous washing with sponges, washcloths, or excessive rubbing. The vulvar skin is inherently sensitive and thin, and it becomes even more fragile with age. Strong friction or over-cleansing can lead to micro-tears, redness, and even subtle underlying inflammation. Internal douching or vaginal washes represent one of the most damaging habits. The vagina possesses a remarkable natural self-cleaning mechanism. When you introduce water or other liquids internally, you inevitably disrupt and destroy this crucial protective system. Avoid using wet wipes, talc, or any scented intimate products. These often contain alcohol, fragrances, and harsh chemical substances that irritate and upset the delicate balance of your natural microflora, even if they claim to be gentle. Now, let's turn to what science specifically recommends for women over 60. Opt for intimate soap with a pH between 3.5 and 4.5, and use it exclusively on the external vulvar area. Wash gently with your hand, completely avoiding washcloths or any scrubbing. When drying, use a soft towel and simply pat the skin. Never rub. Steer clear of any scented products in the intimate area, even those marketed specifically for women. Always wear cotton underwear and consider sleeping without underwear at least twice a week. This practice allows the skin to breathe effectively and significantly reduces moisture buildup. A study published in the Harvard Women's Health Watch highlighted that older women who adopted a gentler intimate care routine reported a significant reduction in infections, irritations, and recurrent discomfort. The message is clear. The gentler your approach, the healthier you'll be. Caring for your intimate area is not an indulgence. It's an essential act of respect for the most delicate part of your body. Part 5. Pelvic floor weakness. We'll explore how to regain bladder control, restore intimate tone, and enhance pleasure through simple exercises. Have you ever experienced involuntary urine leakage when coughing, sneezing, or laughing? Or perhaps you've felt an unusual pressure in your intimate area, as if something is descending. These are not signs of personal weakness, but rather indicators of weakened pelvic floor muscles. This intricate system of muscles and ligaments is crucial for supporting your bladder, uterus, and intestines. It's also directly linked to intimate pleasure, urinary control, and vaginal firmness. However, after the age of 60, this musculature naturally tends to lose its strength, elasticity, and tone. This weakening is particularly pronounced if you've had natural childbirth, have been less physically active for many years, suffer from chronic constipation, or have never received guidance on strengthening this vital area. The consequences can include urinary incontinence, feelings of looseness or weakness, and a decrease in intimate pleasure. In more severe cases, it can even lead to vaginal prolapse, where the bladder or uterus descends into the vaginal canal. What's truly absurd is that most women live their entire lives unaware that this crucial area can be significantly strengthened with simple, targeted exercises. These are known as Kegel exercises. gentle, controlled contractions that specifically activate the pelvic floor muscles. They can help you regain bladder control, improve intimate tone, enhance pleasure, and potentially avoid surgery in the future. Here's how you can start right now. First, empty your bladder. Then, find a comfortable sitting or lying position. Contract the muscles of your vagina and anus, as if you're trying to stop urination. Hold this contraction for 5 seconds, then relax for another 5 seconds. Repeat this sequence 10 to 15 times, twice a day. Within just a few weeks, many women report improved bladder control and a significant enhancement in intimate pleasure. In fact, one study published in the International Urogynecology Journal showed that women over 60 who consistently performed Kegel exercises for 12 weeks experienced a 74% reduction in mild to moderate urinary incontinence. It's truly simple, it's free, and it can profoundly transform your intimate health from the inside out. In conclusion, caring for your intimate health isn't a luxury. It's a fundamental aspect of your vitality, dignity, and self-love. While our bodies certainly change after 60, this doesn't mean you have to accept pain, dryness, discomfort, or shame as an inevitable part of aging. On the contrary, now more than ever, you deserve greater comfort, more pleasure, and increased respect for your body, starting with how you treat yourself. If this video has helped you in any way, please consider sharing it with other women in your life. Perhaps this is exactly what your sister, friend, or even your mother needs, those who may have never dared to ask these questions. Let's spread this information with openness and courage, because aging doesn't mean staying silent. It means embracing with strength everything we can still be.